Hello everyone, I am Dr. Rani Samuel, clinical psychologist and author, and today I want to start exploring the topic of trauma. I work in a clinical practice in Durban, South Africa. It is part of a larger medical and corporate center, and I specifically work in a clinical suite that has quite a few psychiatrists and psychologists working together. We all run our individual practices, but we have the opportunity of liaising as colleagues. There's a very large waiting room where all our patients sit and wait for their appointments. I was quite amused recently when both the reception staff and the colleagues that I liaise with would jokingly tell me that I have some of the best patients. And that's quite amusing to me because I know their journeys. And I would say to them, well, what makes them the best patients? I'm quite confused. And one of them said to me, well, they come on time. They're extremely well-mannered. They sit quietly and they're extremely well-dressed and well-presented. And they said to me, that's quite the standard. And they can pick my patients out in this very large waiting room. I know the struggles my patients went through, and that is now quite amusing to me for them to be recognized in this way. You see, trauma and what it means is something that's very vast and affects everyone. We refer to the people in our waiting room as patients, but who is really a patient? The word patient comes from a Latin word, and it means one who suffers and one who endures. So in some sense, we are all patients because all of us have suffered and endured in some way, be it spiritually, be it emotionally, be it physically. What about the word trauma? The word trauma has Greek roots and it means a wound. And these wounds can be physical or they can be emotional wounds. And a physical wound can be an assault, it can be violence against you, but an emotional wound can be caused by years of emotional violence to you, violence to your soul. It can be neglect, it can be rejection, it can be abandonment, any number of things. Words and particular events can also injure you. Today, I want to tell you about a patient of mine whose name is Josh. He's 40 years old now, to explain how trauma can impact somebody. Now, Josh, I have known for 10 years. And no, I didn't see him every month or every week for 10 years. No, the first time I met him, Josh came to me with severe heartbreak after a long, important relationship had ended. He is highly intelligent, he's a design engineer, and he's very focused on personal development, as most millennials are. This is critical for them. But on first contact, it was heartbreak to deal with a very, very important relationship that he was in for many years that ended. And he found my office to be that safe space where he could grow emotionally, where he could deal with the grief. And I saw him on and off. And then we would meet once a month when he was doing really well. When there was a deep crisis, be it at work or personally or in his family, he would see me a little bit more often. But fast forward 10 years later, we had developed this really strong therapeutic relationship. It was foundational to his stability. It was the place, and I was the person that could anchor him, that really understood his journey and who he was and what was important to him. About 18 months ago, he underwent some severe stress. It started with a retrenchment, and he's a very specialized, sought after design engineer. And at the same time, his parents, who were older, his father got extremely sick and deteriorated. And we saw this coming. It was suspected that he had dementia for a while, and he had to be moved into a nursing home. And it was a quick deterioration. And I started preparing Josh for the end of life stage for his father, to prepare him for the grief, to walk him through all of that. The thing that shocked us was that his dad passed away peacefully on a Monday, and immediately after that, his mother became sick. And we thought it's just the grief. Josh adored his mom. They were really so close. So they decided to admit his mother to hospital, remembering that his dad just died on the Monday. There was a lot of grief and sadness around that. On the Thursday of that same week, his mom deteriorated, started gasping, went into cardiac failure, and she died on the Thursday. And during this time, Josh went for an interview, and he got this job of his dreams in a new city. And all of this just came crashing down on him in 1 week, in a matter of days. And this was immense trauma. It was crisis. But he had the support structure to navigate this crisis. He had known me for 10 years, and we had a safe space to process all of this. However, what was his first response at the end of that week? Well, Josh was simply numbed out. He was disconnected. He was telling me the story like he's on the outside of all this trauma, like a journalist or a news reporter telling you about the events of somebody else's life. Are you a little bit like that when you are going through difficulties? Just know that in the beginning, it's quite normal to feel a bit distant. It's almost protective, but you can't stay in that space. What I've seen in other patients is something more extreme. Their first responses to trauma is they just want to wipe it out. They want to erase it. They want to eradicate it, banish it. It's almost like it's just not happening. And we have a term in psychology called dissociation, which is kind of the more extreme disconnection that people go through. It's sort of a distancing, even in cognitive and mental functioning. It's a deep disconnection of feelings and thoughts and memories of the trauma. We have a disorder called dissociative disorder, and it's extremely distressing, and it can lead to constant suicidal thoughts. And it becomes almost part of one's identity. And I've had a few patients that were sent to me by psychiatrists who presented with just bouts of dissociation because of high trauma and often childhood trauma that was resurfacing in adulthood. I think especially of one man that I was sent to in hospital, and his wife had just died. And it was a lonely man, and he had found almost his soulmate in this world. And she had no family, and he had just one sister. Both their parents were late, and they had almost found each other in the masses of people, and they married, but 3 months later, she died. And I remember him lying in the hospital bed, curtains closed, and just gazing into empty space, just staring, just glazed eyes, no speech. And he was dissociating. You know, when we say that someone is spaced out, well, he was truly spaced out. And my role was I just showed up every day. I sat next to him. I would greet him. I would speak briefly to him. And then I would leave. But I'd make sure I'd come every day. And then when he started speaking and we could work through the grief, he told me that he knew I was there every single day. He felt my presence. He knew I was seated next to him on the chair, although I was not speaking. And that tells you how important it is that even in the most extreme state of grief, sometimes you just need to show up. So what you need to remember is that your trauma cannot be buried and it cannot be denied. It will surface. If you don't deal with it now, it will surface even in 5, 10, 20 years from now. You know, it's like an untreated toothache. You would get reinfected all the time, and it's going to hurt and hurt until you go to a dentist, see to the infection and deal with it. And as the patient recently reminded me, she says, well, sometimes you've got to pull it out. And I have to agree with that. Trauma is very similar. You have to deal with the wound, you have to deal with the infection, and sometimes you have to amputate it. So what are some of the early symptoms of trauma? If you've gone through something really, really difficult, consider these symptoms which present in the early stages and could become persistent. There'll be a lot of anxiety, which could become panic attacks. If you've struggled with addictions, well, they'll arise again now to numb out symptoms, to escape from the trauma. There'll be lots of fears and lots of flashbacks. There'll be very intense dreams. And patients tell me how they talk and scream in dreams. And this is the post-traumatic nature of trauma. You would carry with you a sense of horror. There'll be lots of anger and hypervigilance. You become incredibly aware of everything that's happening around you. Most often, you would definitely get physical symptoms. Your physical health will suffer in times of trauma. You would get sweating, your heart rate would increase. That's called palpitations. You can just feel the beating even in your ear. You will definitely have some pain. You know, it just could be a headache, it could be a backache, or something more severe like fibromyalgia, which is often activated in trauma. You know, you could have tremors in your hand, lots of sleep difficulties, and your concentration would suffer. Sometimes people tell me it's like just walking in a fog and this fog won't lift. That's what trauma can do to you physically. During this time, you may want to isolate or you may need too much affirmation. So it's one or the extreme. A lot of people withdraw during times of trauma. Others keep talking and will tell anyone that will listen. Very often trauma can leave you suicidal, and therefore the need for assistance is very important. It could be professional care, it could be talking to a friend, it could be talking to someone in your spiritual community, but this is really, really important. What I would like you to know is that the more unimaginable and the more unspeakable the trauma, the more intense the symptoms become and increase over time. Some things are so heinous and so out of human scope that it's actually almost impossible to speak about and hard to find the words. And quite often I would have to get my patients to first write about it before they can actually speak about it. And very often they would write about it and give it to me to read until we get to a point where they can write about it and then read it to me. So if you are struggling with something that's really, really intense and something you've gone through either earlier on in your life or more recently, you can start by writing about it. You can open your phone and make notes in it, password protect it if you need to. If you have more privacy, you can even write it in a notebook. You can start just even writing short sentences about it. Most of my patients alternate between numbing of their trauma and reliving it. But there's certain triggers, and they often your five senses that remind you of the trauma. For example, just seeing something or smell or hearing, touch or taste can help to activate the trauma. And for Josh's example, the patient I've just been speaking about, the sight of his mum in hospital, lying on that bed, life ebbing away from her, and the sound of her gasping for air until they gave her oxygen. This was what kept on triggering the trauma. But we dealt with it quite successfully. We've done medical management on Josh, and I'm pleased to report he's done really well. He's taken the new job, he's moved city, and he's still on his journey of healing, but 18 months later, he's in a far better place. So just for you to reflect, consider what you are dealing with, and maybe consider how you are numbing yourself out. Is it with social media? Is it with drugs? Is it with just simple busyness? Consider your own life and how you normally numb out your trauma. And I would encourage you to seek professional care if you need to. You know, there's two things we tell people at the start. We say to you, rest and hydrate and eat. In the first few days, there's not much more than that you can do. So rest, hydrate, and eat. I want you to know that trauma can be healed in all its forms. I have seen every imaginable trauma that can come on the human face. So do not give up. Just keep taking the next step. Just move forward with the smallest actions possible. Thank you for listening. We'll talk more next time. Bye for now.